radial or peripheral intervention has been something that I've known about since my early days of training as a cardiology fellow. We used to do only femoral artery access early on through the process. And over time, we started to utilize more and more, given a push from the cardiology community to do more radial artery access. And now, we only do radial artery access for coronary intervention. So it was a natural transition. I deal mainly with critical limb ischemia, peripheral artery disease, and that's my clinical focus at this time. And we want to be safe with these patients. We want to reduce the risks associated with peripheral intervention. And it's a natural transition to go from the radial approach. And I think over time, it's just going to continue to grow.